everyone. Thank you for joining us. Today, we're going to have a discussion around understanding pain points and lessons learned from COVID-19. And we have a number of really rich technical experts, as well as those that are sort of boots on the ground here in Montana, living the impacts of COVID-19 as we all are every day. So I'm Jayne Morrow. I'm the Assistant Vice President for Research and Economic Development at Montana State University. And I'm so thrilled and pleased to offer this discussion for Innovate Hub as part of Innovate Montana, and to further our understanding of the impacts of COVID-19. As many of you know, the university has been active in addressing some of the challenges that the state has recognized in supporting communities across Montana with connections to technical resources, scientists, and research capacity, as well as leading some discussion around opportunities for diagnostics and surveillance tools to be of greater assistance for our communities, at-risk communities, as well as university communities statewide. So it's a pleasure to be here with you all today, and I am so thrilled to introduce our panelists to you. Today we have Callie Wicks, who is the Senior Manager in Government Relations at Blue Cross Blue Shield of Montana. Callie was raised on a farm in Liberty County. She attended Gonzaga University in Spokane, Washington, where she received a BA in political science and a minor in public relations. She also has a master's degree in communications and leadership. She holds an MPA and a CPH from the University of Montana in Missoula. Callie has a background in community and workforce development, higher education, strategic planning, grant management, healthcare, and advocacy for policy work. She is the government relations manager for Blue Cross Blue Shield of Montana, and she focuses on issues like access to affordable quality healthcare, rural health policy development, mental health, and substance abuse disorder. She also prevention, and she also serves as the chair of the Women's Foundation of Montana, and on the advisory board. She's also vice chair of the advisory board for Career Training Institute in Helena. Welcome, Callie. Next, we have Jim Swan, who's the CEO of RJS Associates. Jim provides executive direction and oversight to RJS. RJS is a professional associates program and consultation advisory organization where specialists in fields of education, healthcare, agriculture, natural resources, environmental practices, and economic development. He also, in his work at RJS, supports tribal governance and juvenile justice, Indian law, Indian culture, languages, internal and external evaluation, as well as strategic planning and proposal development. They've completed successful comprehensive needs assessments, market studies and profiles, in-depth research, as well as grant writing and management and trainings. They also provide technical assistance for businesses and business studies for the facilitation of community forums, local, state, and national conferences. He has a PhD candidate in social thought and has extensive experience in resource development. Welcome, Jim.
Thank you.
Next, we have Ken Martinez. Ken Martinez is a senior scientist at HWC. He's also an industrial hygienist, and he's the lone individual on our panel who does not live with the blessing of being in Montana every day. So we're thrilled to welcome you, Ken, from Cincinnati, Ohio. He is a subject matter expert in bioaerosols and emergency management response. He led a 30-year career at the Center for Disease Control and Prevention that provided experiences and international partners as a member of the Global Health Security Advisory Group. He's also an international collaborator with ministries of health in the United States, Canada, Mexico, United Kingdom, France, Germany, Italy, and Japan. Since 2001, he has served in numerous field leadership roles, which he will share some of his technical insights into those responses, including the World Trade Center collapse, the anthrax investigations, the SARS that hit in Toronto, multi-drug resistant tuberculosis, the Gulf Coast hurricane emergency response, and H1N1 pandemic. He also supported the Gulf oil spill. and has provided testimony before congressional subcommittees on Capitol Hill. Welcome, Ken. And last but certainly not least, it's my pleasure to welcome Barb Stiffarm, who is the Executive Director of Opportunity Link and the Program Director for Vibrant Futures. Barb has an extensive background in community advocacy and economic development services for Native and non-Native communities. Barb has been in planning positions on both the Fort Belknap as well as Rocky Boy Indian reservations. She is currently a member of the Community Advisory Committee for Policy Links program for environmental and regional equity. She is also the chairman of Montana Community Finance Corporation Board and the Montana Indian Business Alliance. Barb served as a member of the Governor's Council on Economic Security for Montana Families until 2009 and currently serves on the Fort Belknap Investment Board and the University of Montana's Bureau of Business and Economic Research Boards. Welcome, Barb. So it's such a pleasure to have this opportunity to visit with you all. You all have such unique perspectives as to where we are in Montana and what we are able to provide and support communities of all sizes across our great state. And also to welcome Ken's expertise, having been involved in responses at the national and international level before, to share some of our observations and opportunities for innovation to lead in future economic and social opportunity investment here in the state of Montana. So I'd like to start our conversation with a general discussion about the overview of how COVID has impacted your area of work. And I would like to open up that discussion first asking Jim, would you mind sharing just some of your perspectives of how COVID has impacted your community and area of work? And we're going to go around the table for each of our panelists to answer this question.
Well, in terms of our area of work, it's actually sort of expanded. I've done numerous surveys throughout this pandemic, asking, well, how has this impacted your business? And from a standpoint of just work level, it's actually increased due to the fact that there's more funding available specific to COVID response, and there's more need throughout the country, but throughout funding to do certain things, whether it be increased lab capacity, increased testing, and ways of responding to the crisis. So from the perspective of straight up business, it's actually increased. The way that it's negatively affected us is that, especially in Indian country, a lot of our best meetings and work happen face to face, and with the lack of the ability to do that on a regular basis, it's sort of a situation of not exactly losing touch with the clients, but not having as effective interactions over Zoom or email or the phone. And then my staff have been very adaptable as far as working from home. We haven't missed a beat. We haven't closed one single day except for any holidays that have come up. Otherwise, our office has been open 100% of the time since COVID struck. The thing that I think gets on my staff is the human factor, that we're all scared, we're all uncertain. We see it affecting people we know, people we love, and that gets on people's, it gets in their head, and that's just simply being human. And and I think that it's certainly been a learning experience over the last 6+ months, and I expect that we'll continue to learn and develop because this isn't going away anytime soon, and it's something that we're going to have to continue to adapt and be flexible throughout the pandemic as we get these additional waves, not only within our community but within our client base.
Yeah. Thank you for that feedback. It's I think going to be a common message, the impact on both health and mental health, as well as our economic and social impact. So I look forward to those opportunities to further that discussion here today. Callie, what are your observations?
Thanks, Jayne. First of all, I just wanted to say thanks again for inviting me to be a part of this panel. It's lovely to see all of you guys virtually, and it's, again, quite an honor to be here with all of you. At Blue Cross Blue Shield in Montana, at the front of everything we do is really providing affordable access to healthcare for our members. And with COVID-19, what we have seen is, virtually overnight, everything changed. So we really focused on a couple of areas where we wanted to make the most impact. The first was for our members and our providers. We wanted to make sure that people still had access to healthcare. So we worked very quickly with the governor's office, with our providers, and with stakeholders in the healthcare community to make sure that the governor was able to put out an executive order highlighting telehealth and new uses for telehealth. For example, audio is now something that we can use. So via phone, you can get your medical care. I think that's been very important for something that Jim mentioned, mental health. As we go through this pandemic, we are seeing both employees and our members really wanting to access those mental health services. So telehealth has been a wonderful thing for us to make sure that our members and our employees are, maybe not having to go to a physical location where they could potentially be exposed, but able to access care in their own homes. So that has been something that we have really worked hard on. Additionally, we were able to put together a pot of money to really support our communities during this time. We worked with the area councils on aging, the food banks, all kinds of entities throughout really the state of Montana just to hit that initial response. Another thing that I think was very, very important was we quickly transitioned our employees overnight to work from home. And I suspect we'll probably hear a little bit more about this from some folks a little bit later in the panel. But what we really found from that was, even in Helena, where we are headquartered, we had folks who did not have access to the internet and, broadband or really stable internet connections. So we worked very quickly to make sure we got those folks access, got everything up and running, and were able to serve our members. But I think that the pandemic has additionally highlighted the need for broadband internet as well.
I think those are really interesting points that we can have follow-on discussion around opportunities from what we're learning around COVID and COVID response. So I look forward to that here later in the panel. Ken Martinez, what are your observations?
So one of the biggest observations I had, and for the record, even though I'm not living in Montana, I did grow up in Colorado in the Denver area, so I can appreciate the beauty of the Rocky Mountains and envy many of you, all of you, as to where you are. You get to see that every day. Living in Cincinnati, there is no place to run away and hide. So I spent a lot of time fishing and backpacking in my youth. So anyway, moving forward. So what have I observed? So in Cincinnati, I've been a remote worker for the past 2 years. My company operates in the Washington, D.C. area, so I did travel there quite a bit, but for the past year and a half, I've been remote. So I'm used to the concept of not being in an office and interacting with people. So I got it when the pandemic hit, and I was doing this on an everyday basis. So one of the things that I observed was early on when the first press briefing occurred is that the deputy director for CDC got up and she said, brush off your pandemic preparedness plans. Well, I'm sure a lot of companies out there in businesses developed those, but they wrote those, they put them on a shelf, and they walked away. The major component of preparedness is exercising, is understanding if you can execute what's in that plan, identifying where the deficiencies are, and fixing them. And so that was never done. And so even though we were believed to be prepared as a nation, it turned out we were not. Some of the other things that were missing were, of course, the correct information, because this is a new novel virus. Nothing was known in the beginning, and you kept hearing the guidance change and evolve based on what was the new scientific information at that time. Bear in mind that what we are seeing now is that a lean in the scientific community that this is airborne, and that has great impact, because if we think about influenza, we normally think of contact as being the primary point of transmission. I have to come close to you. I touch a surface that's been contaminated. But if it's in the air, then that creates a whole different dynamic. It's no longer just a medical response. It must be an environmental response. And that means cleaning the air. That means creating distances between people, trying to minimize that opportunity for something to get in the air and you potentially inhaling it, which is why we are all wearing masks, why we are advocating for certain changes in the environment. So I have observed in small businesses, people who've taken that innovative approach. I've been preaching that this has been airborne since probably February because of my previous experience with SARS and influenza, the pandemic of 2009 H1N1. So it was just a matter of time, in my opinion, as an aerosol scientist. And now we're seeing that. But I had a business trip and went through an airport, and it was sitting in the lounge. There was nobody in there. I wore my mask, and I started talking with the person working the bar, and I noticed a recirculating HEPA filter, actually 2 of them in this small area. And I said, what gave you the idea to put those in place? He says, well, we've done a little bit of research and thought, man, this might be important as far as protecting our clients. And I said, it was perfect. Innovative thought, someone who just did a little bit of research and played off of that. It was not that costly, but it helped to give confidence to their customer base that they're doing what they can to create a safer environment. So as far as how has it impacted the business that I work in, I took it upon myself to educate my fellow colleagues about SARS-CoV-2 and COVID-19 because of my past experience. I let them know what a virus is, what a vaccine is, what it does. An interesting twist on that is my son came up to me and asked me, he said, Dad, so the vaccine will kill it, right? And I said, no, we have no way to kill the virus per se. The vaccine enhances our body to recognize it so our body can fight it off. That is really the only way that we can battle a virus. A virus is one of those things, it's not like your bacteria or fungi that's a living thing, if you will. Viruses are nothing more than a shell with genetic material in it, and they take that and they inject it into your cells and force that cell to create copies of itself until it gets to the point where it bursts that cell. And it does it over and over and over again. So you don't have any way to kill the virus per se because it's inside your cells. So if our body recognizes it, then our immune response comes into play. Our first time seeing it, our body sees SARS-CoV-2 and it watches it going by and says, yeah, doesn't seem to be a problem, until it starts killing cells and the body says, oh, heck no, I'm going to deal with this. And so that's what we're waiting for. That's what we're waiting for on the vaccine. So I started educating, point being other staff members on those issues. I started looking for opportunities to collaborate with others. With Dr. Morrow, we're actually working on a nonprofit to help to create a forum for sharing information where we want to convene the scientific community, but then repackage or reshape that information so we can get that to those such as your small businesses on what they need to do. Because seeing that guidance from CDC, it has a lot of good stuff in there, don't get me wrong, but if it keeps constantly changing, your reader in the mom and pop stores are saying, well, what do I do with that? So we're trying to create that communication of effort. So along those lines, we need to train, we need to educate, because this thing is still changing, but we now have enough information that we begin to create an environment that is safer. It's not perfect. And as Jim had said earlier, this is not going away anytime soon. So we may be bearing with this for the next year. until we start seeing this thing quiet down. But even that is questionable right now because waning immunity has become an issue. What that means is that people, if you've got the disease, there were already cases, confirmed cases of people who've gotten sick again, 3 to 6 months left after the fact. So that needs to be a consideration. So I'll get off my soapbox now.
Thank you for joining us, Ken, and thank you for those insights. I look forward to integrating some of your comments into our discussion and follow on. Barb, what are your observations?
Well, we started off with, we're rural, very rural communities. And, you know, the frenzy over toilet paper, you know, was kind of the highlight of the start of this pandemic and what shutting down would do, you know, in communities as far as having access to supplies. I run a public transportation system, and so you know, when we started hearing about that there might be a shutdown or that there was something going on, we started trying to order some of the supplies that we would need in order to keep our public transportation system safe. The temperature, ability to take temperatures and have gloves and sanitation supplies and masks. And so this pandemic started, we shut down, I believe, March 17th or 18th. And we got our supplies on May 5th. So the realization of how rural we are and that we're the last stop for any supplies, for any assistance, for any type of communications on how to handle things correctly. In trying to reach out and continue to conduct business, you said that advocacy is one of our major projects, and we were in the middle of doing business training for individuals. And honestly, the ability to connect with people, yes, we all went remote, and most of the programs and the people that we work with community members, and so having a home email that people would access and them having access to the internet just literally cut communications off. We didn't find anything where we could look for one source for information. You really have to be connected to 10 or 12 or 15 different types of information sharing in order to even find out what's going on or how many cases we have or where to get policies or procedures for operating even in your own office. So I guess the hard part was, you know, we learned to adapt, but if you're not provided the infrastructure and the tools to be able to be a part of that conversation, we felt like we weren't getting all of the information that we needed. So I really put myself in a place of a community member without access, without a landline phone, because everybody's gone to, you know, mobile units, and people not knowing what that phone number was to contact them and inform them and let them know what's going on. We relied on our public radio stations, but with the shutdowns, everything shut down. So even some of the radio stations were shut down. So that communication was key. And we're trying to identify some ways that information sharing, the last thing you wanted to have happen was for somebody to, you know, it was scary enough without misinforming them and giving them the wrong information. So we really need to work on our communication systems.
I think that's a really excellent point and something we need to weave into our follow-on discussion here as we work into some of these issues that you've identified and helped illuminate for our panel discussion today. Thank you, Barb. So I'd like to shift a little and go a little bit deeper into how your organizations responded and what you found to be really helpful in terms of guidance and where that guidance came from. So Callie, how do you think that your organization handled the initial response? Just looking at the response of Blue Cross Blue Shield, assuming you had one of those pandemic preparedness plans, like what Ken said, what was it like to dust it off, and how quickly were you able to get that in place for your organization?
Thanks, Janie. And we were very lucky in that, Ken, we do have a sort of disaster preparedness plan, and we are required by our leadership to go through that at least once a year. So we were very, very lucky in that we had, our disaster phone trees ready. We knew what everyone who needed to be in the office, everyone who didn't need to be in the office, and they virtually put that in overnight. So I really have to have a shout out to our IT staff who were just phenomenal in making that happen for, more than 600 workers here in the state of Montana, spread throughout Montana. They just did a phenomenal job, and I really can't stress that enough. I think the other thing where, we looked to guidance, of course, was the CDC, various other entities. And really, we wanted to make sure, not only for our employees, but again, for our members, that they had access to care. So one of the first things that we did, and, kind of in conjunction with the federal directives, was to make sure that there were no cost-sharing barriers to treatment for COVID-19 or for testing. So I think that was a really important thing that kind of also helped guide our members in terms of, what do they do if they think they have this? We certainly didn't want cost to be a factor. The next thing we really did, and I think this kind of speaks to what we have heard from Barb too, is really kind of find out, okay, we've got ourselves taken care of. Now, how do we help those entities who are really scrambling? Part of our community effort was giving some funds to tribal health departments across the state, YWCA, YMCA, making sure they could buy things like toilet paper and, temperature check machines and hand sanitizer, because that really, I think, had a huge impact over those first couple of weeks in terms of how people could feel that they could operate safely. So again, I'm really pleased with our plan. I'm sure everybody can relate. Sometimes when you walk through those plans, a couple of times a year, you're like, oh, I'm going to take an hour and have to go do this, but this is why we do it. And we all saw that. So I just, again, think our employees did such an amazing job of making everyone feel comfortable in getting to work from home status.
That's really interesting. Thank you. And also capturing some of the opportunities for sort of communication of those plans and policies that build on Barb's comments as well. So Barb, let's move back to you. When you look at some of those communication challenges, are there some opportunities for lessons learned to emerge already at this sort of relatively, I don't know what phase we're at this point here with the pandemic, but we're learning a lot on a daily basis. So what are some of those lessons learned on communication and policy that you started to allude to in your last comment?
Well, some of the lessons learned would be that we definitely need to work on getting better broadband services in our rural communities and improving that access to that service. Very few, the school systems in our rural communities on understanding that, the families here, less than 53% of them even, have a computer in their home. And so having internet has not been a high priority for them. And so how can we make it affordable? How can we increase the access to that? what are some of the ways that we can utilize that infrastructure to establish a community-wide response. We had a pandemic plan for our public transportation system, because, and we've reviewed it and gone over it and updated it, but mostly it dealt with storms. You know, we've been declared a national disaster area 3 or 4 different times here since 2011 because of winter storms or fires. And so the evacuation process. So how do you turn that language or those types of policies into something that will improve the safety of the community, as far as them feeling safe and knowing that there's somebody out there that's going to look out for them. The timing for some of the shutdowns and stuff have been really difficult for some families here, because we have we do a lot of work on Indian reservations, and literally the supply chain wasn't there, and we did not have access locally to any of the foods or some of the products that were needed in some of the homes. And even if they did, there was no way of a lot of the people couldn't afford to stock up and set themselves up to sit in their home for 10 days and feed 4 or 5 children and keep everybody, you know, healthy. It just didn't happen. So I see that in the future we're going to have to really sit down, and part of our advocacy efforts in the communities is going to have to be based upon what kind of an emergency plan do you have in your community? Where should people go to get the information if this happens again? Where's the most effective place to go where nobody is left out? That was the hard part, was everything you did, you knew you were leaving people out because you couldn't communicate with them.
That's a really important point, and actually something that came up in our Clean 2020 Summit that Ken mentioned earlier, and we will provide a link to for those that wish to follow up on the information that was collected in that summit discussion. There's a real need to translate some of the science and our knowledge and understanding. And what I'm hearing you say, Barb, is that there's a big difference between evacuation and shelter in place. And we need to understand what that looks like on the ground in a real tangible way. Ken, would you be able to speak a little to the role of social science in some of those discussions that we heard at the Clean Summit, and also kind of how that factors into guidance, like what you've observed is generated by organizations like CDC?
Yeah, I'd be happy to. So behavioral science, some of the things that we are structuring the Clean 2020 Summit around was a uniquely different perspective. Quite honestly, when we are approached with mitigating an infectious disease, it's a medical approach. We provide antibiotics, we provide medical countermeasures, things that keep us healthier to enhance our ability to fight off the disease. Well, when the scientific belief transitions to an airborne route, then it becomes an environmental hazard as well. And it doesn't mean that science takes a back seat. No, these two things should be highly complementary. So we need to look at our indoor spaces and see how that enhances transmission, and what are strategies that we can employ, such as increasing filter efficiency, such as increasing the amount of outdoor air. I've always used the adage that I learned in engineering school, which the solution to pollution is dilution, quite simply, and it works here as well. So as far as the summit, we wanted to look at 4 core capabilities: environmental, building science, environmental microbiology, transmission science, because that is still evolving as far as how does this microorganism get from person to person, and lastly, behavioral science, because much of the things that we need to put into play to protect ourselves, to protect our families, to protect our community comes from doing certain things: social distancing, staying more than 6 feet away, wearing of a mask. And these all become behavioral issues. So some of the things that came out of the summit were, if you were trying to communicate things, you need to be consistent in message. The message needs to be simple. It needs to be transparent, and you must establish trust with those you're trying to move that message to. It also needs to be a community effort. So it's not just one subject matter expert drilling down and saying you need to do A, B, C, and D. You have to get your community to believe it, and then have those in the community who are willing to take that next step and communicate that message to others who have not heard it yet in a way that makes sense to them as well. One of the last things I wanted to say, if I can remember what it was here, well, it eludes me right now, but regardless of that, the discussions need to be collaborative. Lastly, on the behavioral, I remember what the behavioral thing was. So how you deliver that message is very, very important. One of our speakers made a statement there. She said, small numbers are not perceived well by the public. And we're all saying, well, what does that mean? So if you tell somebody that only 20% of the population going to be infected, or 10%, and only 2% are going to die, well, they perceive that as, well, it's really a non-issue. But when you present with them the facts that over 8 million Americans have now tested positive for COVID-19 and over 220,000 people have died, it changes that perspective. So reporting of numbers in a way that is receivable and means something to people is very, very important. Or another example of which is those who have not been impacted directly. They don't know anybody who's had COVID, compared to someone who's lost a family member or more than one family member. And you see it in the news all the time, that why didn't somebody tell us this? I would have done things different. And now I'm a believer, but before I was not. So behavioral science becomes a very, very important part of how we're going to battle this thing moving forward.
It's a really interesting perspective, and I'm wondering if Jim would be able to build on that and share some of his observations of how guidance is received and supporting your clients and those that you work with.
Well, I appreciate that everything that everyone said. I've been thinking about all the food for thought based upon what everyone's said, and I do want to build upon something that Ken just spoke about, and then I'll get to the actual question. That in Rocky Boy, where I call home, even though during the pandemic I've barely been home, Rocky Boy has taken this very aggressive approach, and part of it is that the community has built these emergency response plans, but as Barb was mentioning, they have to do with weather. I mean, floods and winter storms and things like that, and I think that the reservation was sort of caught, not unawares, but with having prepared for a different type of disaster, and really did take the bull by the horns. And Rocky Boy's been probably one of the most aggressive reservations within the state of Montana as far as lockdowns. We've had people at the borders for over 6 months now. And the reservation is in the middle, well, almost to the end of another 2-week lockdown, and unless they decide to extend it, which is very possible. And I got invited yesterday to a meeting tomorrow about how to make decisions and get the message out, being data driven. And so the things that Ken was just talking about, especially about behavioral processes, it is really striking close to home. And just to add on to that piece, it's even worse because this is a political year, and because whether to mask up or not is sometimes perceived as a political statement, even though it shouldn't be. It should be just a plain human public health reaction rather than I support this political candidate because I'm wearing a mask, or I don't because I don't. Now, in response to the question, as far as the guidance and support for the clients, we've had our challenges in doing that, because some of our clients really had to respond very quickly. Things that Barb was saying about not having access to broadband, or people not having internet within their home, not having computers, iPads, whatever devices they need for remote learning, telehealth, all of these other things. That's actually kind of driven some of our grant writing over the last 6 months. Is let's get that funding to get the equipment, the access necessary for our clients to be able to deliver their services on a remote basis. And I think that they've been very responsive to advice that we've given, whether, and I'm not by any stretch of the imagination a scientist or behavioral health scientist, to be able to give that real strong data-driven, evidence-based advice. But I've been called upon on several occasions by our clients to try to provide some guidance, and I think they have been very receptive. And as folks who know me can attest, I'm prone to ramble, and so I'm not sure if I answered the question. So I'll see if I answered the question or not.
We're good. That was great. Thank you so much. So I'm recognizing we have about 10 minutes of our discussion left, and I would like to shift gears a little. So I've heard many of your comments in support of ways that you can see improvement based on what we're learning. And with every major challenge, every grand challenge, there comes unseen and unplanned opportunities for positive impact. And I've already heard you mention several in our discussion today. When you look across the response to COVID, and I'm going to let you just, raise your hand that you wish to answer this question. So please just signal to me. I'm not going to call on you individually. But what are some of the opportunities you've seen surface as a response to COVID that really intrigue you, that we need to follow, we need to continue to understand, because it may present ways of enhancing our economic vitality in rural and micropolitan communities in Montana? Callie.
I'll go, Jayne. If that's okay.
Yes, yeah.
Okay, so one of the things that I wanted to kind of build on in our conversation is some innovation that we came across fairly early in COVID. We had actually been putting together a pilot project for our employer clients that would have allowed them to sort of have like a telehealth clinic inside of their offices. So for example, you would go into a room, you could be connected with a doctor via video, and then you would use these devices that are called TytoCare devices in order to get some good readings on blood pressure, pulse. There's cameras, you can look in your ears and throat. And that was something that we were planning on rolling out many months into the future. And what happened with COVID is we sat down with some of our providers and our hospital systems, and they said, hey, that pilot, we want those devices now. We would like to send them home with our chronic care patients. So what we ended up doing, instead of looking at that sort of employer-focused model, was we took all of those devices and we gave them to St. Peter's here in Helena, and they were able to send those home with some of their chronic care patients, so that those patients who are the most highest risk for COVID could still have their appointments with their doctors, could still get all of their vitals, and could still remain on their path of treatment. So we didn't end up having some of these chronic care conditions get out of control towards the, as we move into the pandemic further and further. So that has been something that we're very, very proud of. Again, it's something that our staff worked very hard to roll out. And I think it was under 6 weeks when we had planned on, 6 months. And I think that really showed us another opportunity for how to use those devices. So I really just wanted to say that, that was a very tangible example that we went through.
That's awesome. There are other ideas that you wish to share, observations?
Okay. So for me, and I think this applies to everybody, is if you know something, share it. Not just with your business, but with your community, with your friends. It doesn't mean you have to be learned on infectious disease, but maybe something as simple what Jim was talking about, the other disasters that they've worked with in emergency planning, that he could impart some education to those around him and how they could help to strategically create a framework that would help them better work. What Callie was talking about with, they had a preparedness plan. I mean, and don't just keep it internally, but share what you learned with those in your community about how you implemented that and work with the lessons there to maybe the smaller businesses. So again, my message to everyone is be a part of the solution. It's going to take a while and we need to do this together. And I know people get tired of hearing that, but it should not be about politics. And I heard Jim say that it should not be. And I get so frustrated when people say it's my right. No, your responsibility is to protect those around you, and maybe not the person that you go to the hardware store and visit with, but your family members with you. How many cases, and I'm sure that Barb could speak to that from the reservations, because of how many generations live in the same house. When one person gets the disease, how quickly it progresses. So we need to understand that we need to protect our friends, we need to protect our family, and we need to protect those in our community.
It's really helpful. Barb, you've done some work on remote work. Are you seeing any opportunities to sort of expand that conversation based on what we're learning in COVID response?
The acceptability of remote work, when we first started having that discussion, has it been 2.5, 3 years now? And talking about employers considering having their employees work remotely. So what we're seeing in the state of Montana is that in the larger populated areas, the housing sales have just gone over. And I guess that's one thing that kept me sane all through this pandemic, was that, I felt that all the Zoom meetings and information sharing that I was on with federal agencies and stuff, you could see the individuals working from, and they would explain they were in a high-rise apartment building, and I kept telling myself, well, I can walk outside and I can look at the grass and the trees. And now the younger people, or people that were in those type of settings, have literally decided that they want to come to Montana or to some other rural area. And so we have an opportunity there where we can build our expertise in certain areas, especially like in healthcare providers and educators and people that we need here in our communities to come home Montana. A lot of the discussions that I've held with other businesses is that when their kids left, they said, well, I'm never coming back. Well, guess who's living in the basement now? So, and they're bringing their expertise with them. And so we have to celebrate that. We have to figure out ways that we can make it possible for them to stay. The industries, the companies, the agencies, I think they've recognized that, work can get done remotely, that if they have an opportunity to hire an individual that has the skills and background that they need for their position that they have open, but that person doesn't want to move to that location, they still have the opportunity to hire that person. So we have a lot of people here with talents and expertise that I know that some companies would be totally excited in order to have them join their workforce. So yes, companies that thought that they had to cram everybody into a building and give them all a desk and separate them by partitions are now thinking that this is not the way we can do work effectively. My own work, I had to travel a lot in order to have communication with agencies and find out and learn about what their programs were doing or how to apply for their funding. It would take 3 or 4 days. It takes me and 4 hours to get to an airport and then fly out. So usually traveling was taking up a day and a half of the time that I would be out of the office. And now I can just join a Zoom meeting. So, but I've had twice as many to go to, but there are opportunities, and there's an opportunity here for our communities to really take hold of what was missing. Broadband, the infrastructure, the communication systems, and really invest in those for our communities to help build it, whether it's for a storm or for continued health and well-being of their community members throughout this, however long it takes. I don't think that we're going to be out of this in any time soon, and even when we do, how will life be different? We have to be thinking about that in the future, and what can we do in our communities to make them more resilient and to improve their ability to still be part of commerce and still be part of the education process.
Thank you. That was really well said. Jim, do you wish to build on any of those comments from Barb thinking about resilience?
Pretty much all of them, but I was thinking as Barb was talking about, that brain drain that Montana has experienced over the years. When Barb said, the younger generation, thank you for including me as part of the younger generation, Barb, because I was one of those guys that said, I'm never coming back except to visit. And here I've been back in Montana for 22 years, and I've found that just in the line of work that we're in, a lot of it can be done remote. I've got one staff member that lives in Poplar. I've got another staff member that lives in an RV, literally. And so our adaptation to that remote work was pretty simple. I think that probably the biggest challenge is getting people set up with desks, and also having to deal with the fact that in some cases they've got kids or other family members who are at home, and having to deal with those distractions. But as far as the adaptation to doing the actual work is concerned, it was relatively simple. We didn't have a pandemic plan, and we don't, and we flew by the seat of our pants, but we didn't have to, luckily, address a lot of things that have been discussed as far as people not having internet or access to devices to be able to do work from home. And the lessons to be learned, this thing isn't going away anytime soon, but let's just say we waved a magic wand and it was all gone overnight. How do we move forward in the future? How do we become resilient in our communities, in our businesses, in our educational institutions, in our healthcare practices, and environmental practices? I very much appreciated what Ken said about well, this is an environmental issue as well, just due to it being airborne. But it's what do we take away? What do we learn? How do we utilize what has happened over this entire pandemic in moving forward. Our local tribal college has wanted to do research for quite some time, and it's been sort of fits and starts. But I had a very interesting discussion with our director of institutional research at our local tribal college yesterday, and he's got all of these ideas. Some of them are a little bit crazy, but some of them are really innovative, and this opportunity for research that exists can actually help build up the capacity of our tribal colleges and of our tribes to develop our own evidence base. We always rely on these evidence-based practices that mostly do not apply to rural communities and certainly do not apply to Indian country. And we've wanted for some time to develop that research base within rural communities, within reservation-based communities, and this provides us that opportunity. And it's something that we have to, it's opportunities knocking, and we need to answer the call as opportunity knocks.
Thank you. I think that's a really great way for us to start to close out our discussion. So I just want to summarize some of the things that I heard in our discussion today. And I know we lost Barb because we went a little bit over, but I'll try to capture some of her feedback here in a quick summary. So we talked a bit about the impacts of businesses and thinking about the human factors that are involved in some of this, some of the impact, and how we can support our ability to be more human and care for each other in really diverse ways, as well as just following guidance that's available, wearing a mask when you're in a space where you can't social distance, being respectful of caring for each other as a primary principle, which Montanans all know and do so well. So mask up, Montana. Also thinking about ways that telehealth and other technologies can help support our diverse communities, and what are some of the limitations to access to those tools, because they have been so critical and will likely continue to be critical going forward. And that was a comment that Barb made, and that it really resonated with me, is really thinking about that infrastructure and making a forward lean to develop that infrastructure, really aggressively knowing that that is a key piece to being able to be better prepared and more resilient. And as she put it, take hold of what is missing. And as we think through our lessons learned and the opportunities for resilience to come forward as we're learning from COVID, and so many of our communities are in active response right now. There's still so much to learn and so much to do. I'm greatly appreciative of you all taking time for this conversation today and really thinking about ways that we can continue to innovate and work together in support of our communities. And thank you for sharing your thoughts and feedback so candidly with our discussion and with the Innovate Hub team and what they've put together for the state of Montana. And one thing I heard that I just really resonated with me as well is we've talked about people that are joining our communities new. We're talking about people that have come back home, and that we're seeing an influx of young people coming back to live with their parents in a safe environment of their communities in this real-time dynamic time. We also are talking about giving back to the state. And these are all ways in which we can support each other through our knowledge. And one of the things that Ken said is really caring for each other with our knowledge and making sure that we're sharing what we know. And so thank you for your time in doing that today. I think you've shared some of your knowledge and insights with us all today, and I look forward to future conversations with you all. So thank you.